so pleased to have you here today. I am Pauline and I'll be your moderator today. I am joined by Dr. Amelie Therrien and Emma Frank of the Beth Israel Deaconess Medical Center, Celiac Center, and by Kate Avery of Beyond Celiac, who's our co-host for this event. Today's webinar is about taking action on celiac disease, which delves into Dr. Therrien and Emma's foray into celiac disease research and how you as individuals with celiac disease or someone who knows someone with celiac disease can find resources and be proactive in managing this condition. First, I'll let Kate at Beyond Celiac introduce herself and what celiac disease does in this area, and then move on to the discussion with Dr. Therrien and Emma.
Great. Thanks, Pauline. My name is Kate Avery. I'm the Director of Research and Patient Engagement at Beyond Celiac. So Beyond Celiac is a patient advocacy organization in the United States. We provide support for people with celiac disease education and resources. And we are also really committed to there being a treatment or a cure beyond the gluten-free diet for celiac disease. So to that end, we fund research directly. We give out research grants to scientists. We also have a patient registry called Go Beyond Celiac, where we're collecting data from people with celiac disease in the US. And we also partner with pharmaceutical companies and the academic medical centers to help them find people to participate in their clinical trials and research studies, because we really can't have a treatment for the gluten-free diet without participants who are willing to take part in clinical trials and research studies and help the scientists learn more about celiac disease. So we are happy to co-host this webinar and glad that this is a way for people to learn more about managing celiac disease and opportunities for celiac disease. So I'll put our website in the chat, and I can unfortunately only be here for about 15 minutes or so, but you're certainly in good hands with everyone else. I'll turn it back to you, Pauline.
Well, thank you for that, Kate. I'm sure most people know about your organization and all the work that you do. And if you don't, as she mentioned, she'll put the link to the Beyond Celiac website in the chat box, and then we'll include that in a follow-up email to this webinar. All right, and then now I'll go ahead and dive into the discussion. So the first topic that we wanted to share is first about how Dr. Therrien and Emma, you got into celiac disease research. Would you like to share your story?
Yes, so I have celiac disease since I am like 18 months old. So it's a different experience than most of the celiac community, as it is really impregnated to my lifestyle. I have not known anything else in my life, but it made me curious about the intestines, trying to understand why it was happening when I was a child, and then to dig into the pathology and how the immune system worked. I was initially followed in Montreal by an IBD expert who had interest in celiac disease, but there were no celiac center, and lots of people did not have GI follow-up. And around 2011, I realized that there were celiac centers in the US, and there were so many unanswered questions about celiac disease, and there could be something else to do than the gluten-free diet. So at some point, someone else recommended that I do a clinician scientist residency pathway, and I ended up doing it in Montreal, but then applied to advanced research fellowships at some celiac centers in the USA and moved in Boston in 2018. And I learned a lot of things with Dr. Karen Kelly and Jocelyn Silverster. And I realized moving to Boston and interacting with the other centers that many people in the celiac centers and the research teams actually had celiac disease. So it was the first time in my life that I was surrounded by people with the disease, and it was very, very nice not to have to explain, not to eat differently than the group. And it inspired us to do a survey that we sent to the celiac research community. And we found that 42% of the respondents had a connection with celiac disease, either themselves, their family, or someone in their research team. So this is, I think, quite unique with celiac disease. People with celiac disease are interested in learning more about their disease, improving their care, their quality of life, and also as a team leader in research, in for the center. It is also good to hire people with the disease. So when it comes to discussing with the participants about having an endoscopy for research or taking gluten for research, it feels easier, more connected when the person you're talking to also may have the disease. Emma joined the team last December, and I will let her share her story.
Great, thank you.
Yeah, thanks. So I'm Emma. I also have had celiac since I was a little kid. I got diagnosed when I was 4 years old. So I grew up in Boston. So I grew up kind of in the Beth Israel pathway of being a kid in the Celiac Kids Connection. So I grew up really loving that community, and I studied nutrition in college and food science. So I decided that I really wanted to take that to a more personal level and do some research around celiac disease, because it's something that I live with my daily life. A lot of people do, like Amelie said. So I'm just excited to learn more, and yeah.
Cool. Well, thank you so much for sharing your backgrounds, Dr. Therrien and Emma, in getting diagnosed with celiac disease when you were so young, and then that prompting you to pursue a field, to learn more about this condition, not just for yourself, but for others, and how you can, find new therapies or new ways of addressing this condition, and living in with it, you can really empathize with the patients that you see, right? All right. And so, I think a common message that I've heard from people who we've interacted with throughout celiac disease research, as well as those who have submitted questions here, is that they really struggle to find a diagnosis of celiac disease. And I'm guessing when you were diagnosed when you were so little, that almost is like rare. Like doctors don't really know about celiac disease, and people often get misdiagnosed for years until later. So can you share more about how you came to your diagnosis and your experience with kind of how people get diagnosed now, and how they can more proactively figure out, getting diagnosed?
Yeah, so I was diagnosed in like 1989. So the prevalence of celiac disease was way less at the time, but I say prevalence, but the cases we know with celiac disease, it was less diagnosed. And my pediatrician, in fact, had a daughter that had Crohn's disease. So seeing my presentation, he felt like, oh, she needs to go see a PGI. And then I got, in fact, the Crosby capsule, which is like a little like capsule that you swallow with a string. And then it's kind of like guided in radiology through your stomach and your intestine. And then when with the radiologist, they feel that it's in the intestine, they open the capsule and it cuts like a big chunk of the intestine. So this is how I got diagnosed, like back in the day. So I didn't have like a formal endoscopy, but working with the celiac population in Quebec, the Celiac Association, and in Canada, I'm very sensitive about how like it takes a very long time before some people are diagnosed, because when I was diagnosed, I had the classical presentation. I was like not gaining weight, having lots of diarrhea, being super lean. But nowadays we can see celiac disease with like so many like different clinical presentations, and without awareness, people are not diagnosed, and then it takes like 7 years before eventually they get diagnosed. And it's not rare that people are in fact like asking their doctor like, oh, can you test me for that condition? I may have it, or my siblings have that condition, I should be tested for celiac disease. So it's still a problem, I think, like worldwide, this maybe lack of awareness from some doctors that celiac disease is not only presenting with like having diarrhea and weight loss.
Mm-hmm. So do you recommend like can patients, if they think that they have celiac disease, ask their doctor, to get tested for it?
Yes, it's totally fair to come to your doctor and say, oh, can you draw some TTG, some tissue transglutaminase, which is the antibody that you need to has the first line for the diagnosis of celiac disease. But another important point is that you must be eating gluten at the time of the diagnosis when you have the blood work. So this is another issue that we are facing often, that people start on a gluten-free diet to kind of like heal themselves because they learn around them that, oh, you may have celiac disease, you should try a gluten-free diet, and then they feel better, but then they never actually get fully diagnosed because of that. So unfortunately, right now, we still need people to be eating gluten in order to do a strong diagnosis of celiac disease.
Okay. Yeah, I think that answers one of the questions that someone submitted. They had asked, they had gotten maybe blood work or genetic test done where it said that they had celiac disease, excuse me, and then they went on the gluten-free diet. And they were wondering, can they, can they still get an endoscopy somehow and to get the confirmation, but they would have to go back on the gluten-free diet to get that. I mean, sorry, they have to go back on eat some gluten for a little bit to do the endoscopy report. I mean, endoscopic biopsy.
Yes,
Sorry.
so to be sure to have like biopsy proven celiac disease, the current recommendation is to be eating at least like 2 slices of bread for 6 to 8 weeks prior to have the endoscopy, to be sure that there are some findings when we do the biopsy. So you do not go through an endoscopy and then like have a false negative. However, the new American guidelines for adults for the treatment of celiac disease, which has just are just out in January. We are sensitive to that part. And in people with already like very, very high blood work, when they were eating gluten, like super high TTG, if there were some delay before having the endoscopy, if they did not get access to a GI and eventually started a gluten-free diet, we could still consider them as a positive diagnosis for celiac, but they need to have TTG more than 10 times higher the limit of normal.
Mm-hmm. So the endoscopic biopsy with the TTG levels, that still is the gold standard for diagnosis. Yes. Okay. Right. Should we continue talking about diagnosis, or should we go into maybe some resources for after diagnosis?
Sure. Yeah. Sure. Okay. So I think Emma has something to show you about our celiac center, but I would say that there are many other celiac centers in the United States, like Columbia in New York has one, University of Chicago, Stanford, Mayo Clinic. There are also a newer celiac center in Birmingham, Alabama with Amanda Carty, in Vanderbilt University with Don Adams. So there's lots of like centers that are spreading in the United States. So this is super exciting. So it increases your access to care. But here at Beth Israel, we have a website. I know that the link may be a bit long, but you can Google like BIDMC Celiac Center and BIDMC Celiac Now. So it details the resources that we have available. And we have lots of like pages in our Celiac Now website where Melinda Dennis, the celiac dietitian, has done like a fantastic job underlying like lots of like common questions about ingredients, common situation. We also with MGH and Boston Children are doing some webinar with the National Celiac Association about once every month or every 2 months about like different topics. And if you can go to the next slide. Oops, okay. So we may not have the next slide, but I already mentioned the Celiac Now. Yes, this. So we have a newsletter that outline like the activities that are at our center. So you can just go out online at our website and register, give your email address. And we have a monthly online group class for the gluten-free diet that is hosted by Melinda. It's completely free. However, you need to be followed by someone at Beth Israel to attend those classes, because if there are some concerns, like Melinda need to reach out to your doctor. So it has to be like within Beth Israel. But before we were doing them live, now we are moving to online, but it's also good to interact with other people that have the disease and share experience. And yeah, so Celiac Now is the main like website with the resources that we have.
Oh.
And
And maybe we should also touch on to the research that you do. I know a lot of people were interested in your specific focus on like mast cell research and other gluten-related disorders. So I'm sure everyone would love to hear about your research and findings here.
Yeah, so we have a few research ongoing at Beth Israel. The ones that are outlined are the ones I am most involved with. First, the latiglutenase drug trial that I will be happy to answer a few questions and explain what is the focus of that drug and that trial. We are also interested in following pregnant women with celiac disease to see if they are having more symptoms toward the ends of their pregnancy and at the time of their postpartum period, because this is our clinical impression that after having their delivery, women with diagnosed celiac disease are having a little bit more GI symptoms after having their babies. So we have a cohort that we send out like some questionnaires to see throughout their pregnancy and in the 6 months after how they are. The mast cells project is funded by the American College of Gastroenterology. So I'm building a big cohort of 300 people with celiac disease and non-celiac gluten wheat sensitivity. And I'm looking into whether some people with more symptoms, more acute symptoms when they are exposed to gluten, have more mast cells in their intestine. Could they have a genetic condition called hereditary alpha-tryptophanemia that contributes to some symptoms in celiac disease? Because we know that some people with celiac disease are mostly asymptomatic, and it's hard for them to adhere to a gluten-free diet, because what is the point if I'm not having symptoms and I just got screened because my sibling had celiac disease or I had like a little bit of anemia? It's hard because you do not know, am I exposed? Am I really following my gluten-free diet? Is it worth it? But on the other end, some people are like super symptomatic as soon as they get exposed to gluten. So we are looking into that with this mast cell project. It does not involve much from the participant, just to have blood work with us and some saliva swabs so we can see if they have a mutation involving their mast cells. And finally, we have a colostrum study that does not necessarily target people with celiac disease, but in general, we want to see if the colostrum prevents the absorption of gluten in the digestive tract. So we are still looking for people who are on a gluten-free diet. And we want to see with like the colostrum and a little bit of gluten, does it block the absorption, like to have another type of like nutritional food that could help with people, for instance, that have non-celiac gluten wheat sensitivity. So these are the main projects that are currently enrolling and that I'm involved in.
Oh, thank you. Quite a variety of things, looking into
Yes.
anywhere from I guess the epidemiology of celiac disease and the symptoms that are associated with it, to treatment therapy studies, to as you mentioned, the gluten reaction. So if you don't mind me asking, actually, could you explain what mast cells are? Because I don't think not everyone may know what mast cells are and its connection with celiac disease.
Yeah, so mast cells are cells from the immune system that are more linked to allergy. They have like large granules inside, and if they get stimulated, they release their granules, and the granules contain like histamine and other like inflammatory mediator. So if you have an allergic reaction, it's mostly your mast cells that are acting up. However, we also know that those mast cells are in the GI tract and they contribute to the general function of the GI tract, the motility, the secretions. But in some people with more symptoms, some people with irritable bowel syndrome, they appear to have a little bit more mast cells in their mucosa. And the question is like, are these mast cells like having an impact? Because there are other people that have conditions that, let's say, stimulate their mast cells. Their mast cells are a little bit going rogue, and these people are also having GI symptoms. So we do not know yet exactly what could be the connection between mast cells and celiac disease. In a study we did in the last 2 years, we saw that some of our patients with celiac disease had lots of mast cells in their GI tracts, and other did not have much mast cells. So it's still an area that we do not know a lot about. And I think this is why my project got funded by the American College of Gastroenterology to try to find more about that.
Mm-hmm. Oh yeah, and of course, congratulations on getting the grant for that research. Cool. And I think there is kind of going back to some of like the diagnosis part of it, there seems to be a genetic connection, I think, between family members with celiac disease. Can you kind of comment on the maybe hereditary or genetic factors of celiac disease?
Yes. So to have celiac disease, you need to have the HLA gene. HLA are like little antennas that are on the immune system that can recognize the gluten. So there are currently 3 known phenotypes of HLA, 3 known types of HLA, the DQ 2.2, 2.5, and 8. But people can have HLA 2, 3, 4, 5, 6, 7, 8, 9. And about 40% of the population has either DQ2 or DQ8 as a gene. So their immune system could recognize the gluten, but it needs more to develop celiac disease. It needs intestinal permeability. It needs to have other activation of the immune system to develop an inflammatory reaction to gluten. Because even if you recognize gluten, you may tolerate it. And people with celiac disease do not tolerate the gluten, and then they are having more inflammation. And only 1% of the overall population has celiac disease. So it's not like all the 40% that are genetically predisposed. When someone in the family has the HLA or has celiac disease, the risk of the other family members to have celiac disease is about like 15%. For children, for instance, you could consider do HLA typing as a first like screening if the child is fine and not having much symptoms. And if they are not carrying the HLA DQ2 or DQ8, that kind of like eliminate the possibility that they will eventually develop celiac disease. However, it can be costly, like with the copay, some centers is about $300 per test to have that testing done. But overall, we feel that between 7 to 15% of the siblings, first degree family members will develop celiac disease when someone in the family is affected. I would say, however, when I mentioned the HLA, that there are 4 parts, like it's kind of like 2 alleles because you have 2 chromosomes and each chromosome has 2 parts. So sometimes people are confused because one child has celiac disease and both parents are tested negative for the HLA. But that doesn't mean that something weird happened. It's just because one parent can have 1/4 of the HLA and the other parent has the other 1/4. And that was not enough to be detected with the test. And both of them transmitted their kind of like part of the allele, and that made the full allele for the child. So I just wanted to clarify that because sometimes I get that question in clinic.
Yeah, definitely. So that kind of explains why, like in a family, one kid may have the celiac disease and the other kid doesn't. it's kind of less than a quarter percentage chance of having celiac disease is if someone else has it in the family. And then it also sounds like, based on what you said earlier, is that even if you have the gene, because it requires like almost like the other things in your body reacting to it, it doesn't mean that you will have celiac disease symptoms or the was it the phenotype, like the phenotypic representation. So
Yeah.
that's why the genetic test may not be necessarily always, it's not the gold standard for diagnosis, and is why some studies don't allow people with only the genetic testing, because it doesn't fully show, you know, all the other negative effects that celiac disease has.
No, yes, absolutely.
Oh, cool. I actually didn't know that before, so that was very insightful. Yeah, I see a lot of people mentioning about some diagnoses via blood and things like that, blood and genetic work. Cool. All right. And then let's see here.
And I would just say, because someone asked about 23andMe, is it
Mhm.
reliable? So 23andMe detect the two most common like part of genes that are associated with celiac disease, but it can miss some genes that are associated. So it's not like reliable to exclude celiac disease.
Gotcha. Thank you for answering their question there. I think I guess the next topic that we have before we'll jump into questions and we'll kind of answer some questions related to previous topics where you talked about. But what is the current landscape in the development of new treatments and management of celiac disease?
Yes, so there are different targets. So we just mentioned about like the factors that lead to the development of celiac disease. So this is an area of research to try, in fact, to intercept the disease. So if we know what causes the disease, maybe we could prevent it. We are far from being there, but in Colorado, they're doing very interesting research about that. And there is also some theories that some viruses can lead to, can contribute to the development of celiac disease, and whether some vaccines against some viruses could help like decrease the risk of developing celiac disease. But once you have celiac disease, currently the main approach that is advanced in the pipeline in terms of like drug development, and that is or on which the FDA is focused on for drug approval, is to help people who still have symptoms or intestinal inflammation despite being on a gluten-free diet. So it's making drugs that are adjunct to the gluten-free diet and not quite now replacing the gluten-free diet. So if people have contamination, accidental gluten exposures, or still having some symptoms, it helps and it protects them. For this approach, latiglutenase appears to be the drug that has is the most studied and is the most far in the sequence to go to market. Some people in the questions mentioned like larazotide, but their phase 3 trial unfortunately was stopped last summer. So far there are no drugs that are currently in phase 3. All drugs are in phase 2, but latiglutenase, if the current study is successful, is close to the phase 3 and then a little bit ahead of the other ones. So in latiglutenase and an enzyme, I think we're going to talk a little bit more about that later. I just want to touch upon a little bit about the other mechanism that we can act upon for celiac disease. So currently there is another medication for people with still symptoms despite their gluten-free diet, which is an anti-IL-15. It is a cytokine. IL-15 is a cytokine secreted by the immune system that can contribute to inflammation and make the T cells involved in celiac disease kind of like immortal. There is a drug that is subcutaneous that is currently being studied for that. There is also an oral TTG inhibitor. TTG is the enzymes in the intestine that makes the gluten being more toxic, being more like recognized by the immune system. So there's currently another phase 2 in Europe for the same like population, people that have still symptoms despite their gluten-free diet. But I know that the hope is like to have a cure, be able to eat like any type of diet. And they are like tolerogenic molecules. So these are medication that hopes to retrain the immune system to tolerate the gluten. So these are IV infusions that have passed phase 1 and early phase 2 studies, meaning that they appears to be like safe a priori for people, and they are trying to figure out which dose is the most effective. But so far, they have not been studied in a large population. So this is roughly the current landscape. And if you want, Pauline, we can talk a little bit more about the lactic glutenase. This is a study that we're doing at Beth Israel currently. Lactic glutenase is an enzyme that helps digest the gluten in your stomach and in your intestine. So in the end, the gluten is kind of like cut down in little amino acid that are, and segment of amino acid that are not like recognized by the immune system. So the current study solution for celiac. I don't know if we have a slide for that or.
Yeah, let's
Okay.
see if we can share that. Share screen.
And I would say what I'm telling you about the study kind of like applies to most of the study that you would do for celiac disease. I mean, lactic glutenase has this particularity, but I mean, the process of being into a drug trial, it's roughly often always the same thing. So we usually want to make sure first that you are eligible for the study. So with us, there is a screening phone call that occur before like traveling down to Beth Israel to see, do you have a biopsy-proven diagnosis of celiac disease? Are you on a gluten-free diet for at least a year? Do you still have symptoms? And do you have any of the kind of like other conditions that makes you ineligible for the study? What is interesting about that enzyme is that, like I mentioned, it has been studied since 2010 in hundreds of people, and a recent study showed that it was able to digest pretty well about 2 grams of gluten, so protect their mucosa from that amount of gluten. And now we want to see in people in real life that are still having chronic symptoms despite their gluten-free diet, could the enzyme help them not having these symptoms anymore and digest the residual gluten that they may be having through cross-contamination, etc. So we want to first see, is the celiac disease still a little bit active? Are there still elevated celiac antibodies? This is one of the eligibility criteria for the study. So the pre-screen visit, the V0, involves meeting with us at Beth Israel, doing a first informed consent process, meaning that we are explaining to you what we're doing and what data would we collect and who would have access to your personal data. And then we proceed to a blood work to check your celiac serology. The blood work is only like 1 tube, about like 1 teaspoon of blood. And we will tell you after that blood work, like, how does your celiac serology looks like? Are you still high? Are you normal? And then if the antibodies are positive, we invite you to a first official visit where there is a second informed consent process where we go through what will go with the study, what are the risks of the enzyme, having the enzyme. And we proceed with a physical exam, blood work, and urine testing to be sure that it is safe for you to participate in the study. And if I see any abnormalities in your blood work or your urine, I share it with you and I share it with your PCP. And we will also show you how to fill a symptom diary on your phone every night. And then after 35 days of like doing the survey every night before bedtime, we are checking, are you having like enough symptoms, the types of symptoms that makes you eligible for the study. And then we invite you to a second visit, the V2. And at that time, we give you a huge tote bag with the study medication or the placebo, because the study involves 3 big blocks of 5 and 6 weeks, where you would either receive the study medication or the placebo, but everybody will receive the study medication for at least 1 block. So the study medication has to be taken with each meals 3 times a day. So you take, it's kind of a powder that you dissolve with water with the flavor packet. So it forms a little juice that you drink a little bit at the beginning of the meal, and then the second half during the half of your meal. So you have to do that like at every meal for a total of like 17 weeks. We are also interested in having your symptoms every night to compare with before. Are you having less symptoms? There will be some snacks once a week that are provided by the study team. So the snacks may or may not contain gluten, because we want to see if you are accidentally exposed to gluten. For instance, if a friend give you a cookie and say, oh, it's gluten-free, but no, it was not gluten-free. Or if you are at a party and you take a few crackers, a few pretzel, and you thought they were gluten-free, but they were not gluten-free, would the enzyme kind of like protect you? So the goal of the snacks is kind of like to mimic that, but it's not every week that you're having the snack that has gluten. So once a week, you take the snack while you are having the enzyme, and you have to collect your urine a few hours after having the snack. There's not a lot of study visits, only study visits like 1 every 5 weeks or so, where you bring back to us like the empty packets of your snacks, your enzymes, your placebo, and also the urine kit. So it does not involve like lots of time traveling back and forth to the hospital. So this is one of the singularity of the study, is that it's not too much like study visit. There's no like endoscopy. And yes, it's important to be honest. If you did not take the study medication, if you do not take the snack, leave it like unopened in the box, because if the data is not accurate, it may skew the final results. And unfortunately, we may have like something that is less like reliable, less like significant that we would have had if people were all like correct with their procedures with the study. But of course, we understand that lives happen. It's okay to miss sometimes, but as long as you're honest. And then there are like 2 other visits that are similar to the V2, where we give you like new study medication or placebo, new snack kits. We are taking blood, taking the urine samples, and we're also filling questionnaire about your quality of life. So this is in a nutshell the latiglutenase study. It's mostly things to do when you are at home in your day-to-day life, because we want to see, is the enzyme helping you during your day-to-day life? And yes, so I think Pauline may have had, oh no, she's back.
Oh,
Okay.
sorry, I I dropped off again, but great. Not sure where you left off there, but thank you for.
Yeah, I was done. I kind of like explained like what we were doing for the study and how the enzyme worked and the snacks.
Yeah, thank you for giving an inside look into what research from a patient perspective kind of looks like. I read somewhere that participating in research for a condition is almost like being a citizen scientist. And participating in something like this allows you to kind of track your symptoms in a way that you wouldn't normally do, while also getting more involvement with celiac specialists. Whereas what I've heard is that a lot of people who get diagnosed with celiac disease just get told they have a condition, go on a gluten-free diet, and then don't really get a lot of touch points with their care team. So celiac disease, getting involved is in research is one way to really be more proactive about managing the condition, huh?
Yes, and this is in a way what you mentioned about like doctors, etc. This is one of the pitfall of the care with celiac disease, because yes, in the head of many people, it's like, oh, you follow a gluten-free diet, bye, I don't need to see you anymore. But people with celiac disease are so active at many levels with their care, like because they are not like they're kind of like so much helping each other, and the communities they are forming are key in the management of celiac disease, because doctors and dietitians, of course, dietitians at celiac centers are more used to the reality of having celiac disease, but who will discuss with you how to manage lunch hour at elementary school with your kid? What about the food hall in college for college students? The confusing ingredients list, like we had questions about like natural flavors, yeast. What are you doing if you go traveling as a celiac? Like, is it like safe? What am I doing with that? How do I meet with my in-laws for the first time? How am I like explaining that I have that condition, that I'm not being picky, and I have to check like how they cook the meal, and did they use the correct soy sauce, or did they use soy sauce that has wheat? So there's so much to learn as part of the celiac journey, and it's also to learn from others' experience. And the celiac community is very active as helping each other, but also funding research, and also deciding a little bit which research is relevant for them, and deciding to participate in these research. And you're right that to be part of a research study helps you meet with people that know about celiac disease, that can also answer your question. So it's a clear benefit of being part of a research project. Of course, we cannot like offer it's free medical care, but on the other hand, we cannot like do testing or do things that are not part of the research study. For more like clinical management, you still need like a formal visit with for in clinic, but you still get lots of information.
Yeah. All right. I think since we're into the last 15 minutes, I will go into several questions that were presented when people registered, and hopefully this will cover a lot of bases, or at least be adjacent to some other questions that other people were asking. So I guess one of them is what concurrent illnesses are typically seen with celiac disease, or are typically increased in risk due to celiac disease?
Yes, so this is also part of like which management, which follow-up you need to have. So we often see thyroid issues, either hypo or hyperthyroidism, associated with celiac disease, and this can present like after the diagnosis. Like even if you're like very good with your gluten-free diet, it has like no relationship. Your immune system may start attacking your thyroid. So you need to have a TSH check yearly if it is normal, and then if it's abnormal, have some management either with your PCP or an endocrine doctor. Anemia, either iron or B12 deficiency, are seen and usually improve on the gluten-free diet. But if you're still having like B12 deficiency, you may have some autoimmune gastritis that makes you not digest and absorb well the B12, and you may need like long-term supplements. Osteoporosis is also common, and a bone scan 1 year after the diagnosis in adult is required to compare how you stand versus the other people your age that do not have celiac disease, especially in young adults, because it's the time where you're kind of like forming your bone mass. So if it's already a little bit low, we need to act on it, so you're not like developing osteoporosis at a young age in your 40s or 50s. Up to 40% of people have elevated liver enzymes at the time of the diagnosis. That usually resolves with the gluten-free diet, but if it does not, you should be checked for autoimmune liver diseases. And fatty liver disease is also associated with celiac disease, and not necessarily associated with obesity. Some people have some genes that predispose them to having more fatty liver disease, and we see this more and more in the United States. And unfortunately, the processed food that are gluten-free are higher in calories, fat, sugars, and it's not uncommon that people gain like too much weight and become like overweight, obese after going on a gluten-free diet. Women can have delays in having their periods, having some infertility, more miscarriage if they have untreated celiac disease. However, if you are well controlled on your gluten-free diet with normal blood work, normal biopsies, your risk of having infertility, miscarriage is the same as the rest of the population. Otherwise, these were the main ones. There are some neurological manifestations that can be linked with celiac disease, like brain fog, fatigue, neuropathy. I would say also, one question we often have is like, how long does it take to be better on a gluten-free diet? In general, like GI symptoms improve in like 1-2 months, once like the inflammation has kind of like calmed down. However, extraintestinal manifestation like joint pain, neuropathy, fatigue can take up to 2 years to improve. And sometimes, unfortunately, it does not improve. And it's unclear whether or not it's really linked to celiac disease. Unfortunately, once we have normal TTG, we do not have other like markers to see like if there's still some kind of like random inflammation that is contributing to your symptoms or not. But these are the main issues that can be associated with celiac disease.
Thank you for all of that. Cool. And then I think another good question to answer for people would be, what can be done if you accidentally get gluten? What can you do to help yourself? Are any of these new therapies? Oh, I think we lost Dr. Therrien this time. But yeah, okay. Hopefully she'll be able to jump back on to answer other people's questions here. But while we do that, I will go ahead and look through some of the the chats that the messages that people have put up. You can find a celiac specialist, a gluten-free diet. Just Sissy's question. Where to help repair the damage of the life and gluten damage? Yes, I will present that question next to Dr. Therrien when she gets back here. Hopefully her internet returns. But hopefully this is really informative for everyone. While we wait for Dr. Therrien to come back, I kind of wanted to explain some things that she talked about before with like, I think the different phases of clinical trials going on. In case you may not be aware of this, usually when there are new therapies, anything from drugs to even like physical therapies and things like that, they have to go through some like a testing process, clinical trials, and so there'll usually be three different phases before it's submitted to the FDA for approval. There's phase 1 where, as Dr. Therrien said, they're looking at the safety and efficacy, seeing what's a safe dose to prescribe to people and what are the side effects. And if it's safe enough to move on to a larger group, they'll move it on to phase 2 and have a larger population that they're and a very specific population that they're going to test the therapy on. Then after that, they're going to move it on to phase 3 trials where they test it on they enroll a really large number, like thousands of people. And then all of this data from phase 1 through phase 3 is then submitted to the FDA, and the FDA reviews it to see if it's safe and effective, and only if all of the if it's safe enough and the benefits outweigh the risk, do they approve it to be sold or marketed or given or prescribed to people. and that can take several years. And great. Oh, hi, Dr. Therrien. Thank you for
Yes. So
jumping back on.
I'm so
Oh.
sorry. Where did I cut off?
Oh, no worries. You had just finished talking about the other medical conditions that can concurrently develop with celiac disease. And then in the meantime, I just kind of went back to explain the different phases of clinical trials and kind of explain how long it can take for a new therapy to get to market. It can be, I think, anywhere from like 7 to 10 years.
Yeah.
But basically there's 3 phases. So there's a lot of, new developments being tested in, early phase 1 studies and only a couple in phase 2. But after that, it's only 1 more phase before it can potentially reach the market. But yeah, the next question I wanted to ask, if you don't mind answering, is someone had asked, is there a way, like, what can you do after you accidentally consume something with gluten? Is there anything you can take? Is there a way to repair your villi? Are any of these new therapies, potentially will help that?
Yeah, so I was answering that, and then I thought it was only you who were frozen, but it was me. So I'm sorry, but I will repeat. So what I said is that first, like, do not panic, do not start thinking that, oh my God, I'm gonna go back to the way I was at the time of the diagnosis. If you are on a good regular gluten-free diet, to have like 1 accidental gluten exposure will not like significantly damage your intestine, even though you are having symptoms, because the symptoms happens because the immune system recognizes rapidly the gluten and release some cytokine, but it doesn't mean that the intestine is like really hurting. If the symptoms are mostly gastrointestinal, we have been using budesonide at Beth Israel, which is a topical steroid for the intestine, and it can help reduce the immune activation and the severity and duration of symptoms. And it mostly works for GI symptoms and not like the extraintestinal manifestations like brain fog, fatigue, that can also happen with gluten exposure. If you are not sure whether you had a gluten exposure or not, you can test yourself with your urine. There are some tests online like Gluten Detect that can check if in the last 6-9 hours you had some gluten ingestion. It detects like at least 50 milligrams of gluten, which is about 2 croutons, but the sensitivity for that is not like perfect. It has a better sensitivity if you had a larger exposure, like 2 bites of bread or 2 large like spoon of like pasta. So but yes, otherwise I would say if the symptoms are mostly like also nausea, you can take like anti-nausea medication, you can take like anti-acid medication. We know that people can have various different response to gluten exposure. Also, people can have like response that they were not having at the time before they were diagnosed. Like before their diagnosis, they were having mostly like bloating, diarrhea, and then suddenly when they are exposed to gluten, after being diagnosed, it changed to being nausea and vomiting. So this is mostly because the immune system got used not to be exposed to gluten, and then it gets re-exposed to gluten and start releasing those cytokines, those kind of like inflammatory products that makes you having the nausea.
So let's see, would any of these new therapies being developed allow one to consume gluten intentionally?
So that is a tricky question. Currently, the therapeutics that are being studied have shown like promising results to be able to tolerate small amount of gluten. So for instance, latiglutenase in the recent study, what people were able to tolerate 2 grams of gluten without having too much like symptoms or having gluten detected in their urine. However, 2 grams of gluten is like 1/2 to 3/4 of a slice of bread. So it's not like a very large quantity. And we are, of course, it's the hope to at some point be able to eat like a regular diet. But I would say it's a slippery slope. Like the current medications are designed and studied for accidental exposure, having cross-contamination, and not necessarily like eating like everything you want. And it's hard sometimes to know exactly how much gluten is in a chocolate cake or is in a bagel, etc. So right now, I would say no, we are not going in the direction of being able to intentionally eat gluten.
Mm-hmm. Yeah, kind of like we have to get baby steps first, right? Like, as you said, develop something as an adjunct therapy to the gluten-free diet. And adjunct, if not everyone knows, it means like additional therapy, right, to the main one. But definitely everyone is working towards what would be quote unquote a cure in the future.
Yes, and to improve the quality of life, not to have like anxiety and stress if you're going to social situation, not eating because you're concerned of being gluten. Those therapies can still help you feeling better and be able to interact and have foods from the outside with your peers.
Mm-hmm, definitely. Quality of life is so important. Well, so we've reached the top of the hour, and I guess I'll wrap things up here. Is there any like final kind of takeaway message you want to give to everyone about what they can do to be proactive in managing their celiac disease?
Yes, unfortunately, I got disconnected at some point and I lost like some of the questions in the chat. So I'm really sorry about that. But yes, the celiac population is very, very resilient. And we know that research in celiac disease is tough because we are mostly the only condition that to be able to research, like if a drug is working, we need to give a little bit of gluten to people to see would it work. While other disease like Crohn's or colitis, like they don't need to get sick in order to see, like it's just like a treatment for their overall disease. So we understand that the celiac community is doing some kind of like extra legwork to try to find a cure for their condition.
Mm-hmm. Definitely. So I know we weren't able to answer everyone's questions here, and I regret that we weren't able to, but we will try and address as many of people's questions and the follow-ups to this. There's resources that we'll send to you all, including the slides that Emma provided there, as well as links to Beyond Celiac's resources. Lots of lists there, including like how you can be both an advocate with like labeling legislation and finding support groups, finding celiac specialists in your area. I know that's a main question that's come up a lot too. So we'll try and get all that information to you after this. And hopefully you've taken a lot away from this. And if you have any other questions, seek out your local, celiac center, or reach out to the contact at Beth Israel Celiac Center, and hopefully you'll get you connected with someone who can help answer your questions. Cool. Well, thanks again so much, Dr. Therrien and Emma, for all the information, for your time today. It's been super informative. I know I have learned a lot, and I am hope I don't speak kind of feel like I'm speaking on behalf of the community, but I'm so thankful to have people such as yourselves to be, such a great voice, in the celiac disease community.
Thank you, Pauline.
Mm-hmm. Well, all right. Well, I'll let you go, and to everyone, thank you for joining, and have a great afternoon or evening or morning for wherever you are.
Thank
Right,
you.
thanks.
Bye-bye.
Bye.